Hello, welcome to 5 Minute Fertility, where you can learn fertility facts in less than 5 minutes. I'm Dr. Stephen Sawin from South Jersey Fertility Center, and today we are going to be discussing in vitro fertilization, otherwise known as IVF. IVF literally is fertilizing eggs in the laboratory outside of the body and has been used for over 40 years to help infertile couples achieve pregnancy. The first baby from IVF was born July 25th, 1978, which means in 2018, she celebrated her 40th birthday. Since that time, there have been millions of babies born across the world from IVF. In the United States alone, over 250,000 cycles are done per year with in vitro fertilization. Let's think about what it means to undergo an IVF cycle. The indications for IVF typically involve things like blocked fallopian tubes, extremely low sperm counts, or failure with other fertility treatments. However, the indications have expanded to things like genetic diseases, cancer treatment, gender selection, and many others. IVF also can be used to freeze eggs for fertility preservation for women who are delaying childbearing. So let's think about the normal menstrual cycle and what it involves to achieve a pregnancy. We know that the egg grows from follicles, which are in the ovary, and normally in humans, one follicle will release one egg into the fallopian tube, which will be fertilized and divide into multiple cells as it enters the uterine cavity. So we need to recapitulate the same things that are happening in the fallopian tube in the laboratory. That means we need to be able to achieve a collection of eggs and sperm to put them together in the dish and watch growth of the embryo until implantation. The process involves doing injectable fertility medications, which are small, tiny shots done under the skin for about 10 to 12 days. During that time, ultrasounds are done to look at the little follicles in the ovary grow until they become big. This involves ultrasounds every couple days with blood work in the office until the follicles are the right size for us to do the egg retrieval procedure. Now, this looks involved, but it's done under anesthesia in our office, where we can gently guide a little needle into the follicles and take the eggs out. The same day, we can get sperm and put sperm and eggs together in a petri dish to fertilize them. I will show you a picture of actual eggs or an egg that has been retrieved. This is what it looks like the next day when it's fertilized, and here you will see that it has divided to 2 to 4 cells on the next day. It has grown to about 6 to 8 cells on the third day, and keeps growing until it reaches what's called a blastocyst stage on the 5th day. This is the natural stage of the embryo when it is ready to implant, and therefore, once it's reached the blastocyst stage, we are ready to go ahead and place the embryo back into the uterus. Advances in IVF technology have allowed us to do a single embryo transfer for most patients, avoiding the complications of twin pregnancies. We do know that some embryos are going to not be normal, and so there's the opportunity on the 5th day to sample some outer cells here from the embryo and send them for testing to make sure they're genetically normal. That involves freezing the embryos and waiting until the next month to place them back into the uterus, or place one embryo back into the uterus, I should say. Freezing embryos is a very excellent technology to allow for optimal fertility success rates. IVF is a very successful fertility treatment with success rates that can generally exceed 50% in many patients under the age of 38. It is more successful than most fertility treatments that we offer, however, is usually not the starting point for most patients. Many patients will undergo less aggressive and simpler fertility treatments first, and then move on to IVF if necessary. Thank you for watching 5 Minute Fertility, and I hope this has been helpful for you.